Hello. Hi, good morning, everyone. Welcome to the Knox Partner Program webinar for June. This month, the focus is on digital health solutions, and we even have a partner, Ohum Health, as just to give you an overview of the agenda today. So this session is going to be focused on digital health and trends related primarily to telemedicine. So we're just going to speak about some trends in the industry, some of the value proposition that is offered from Samsung side, some success stories and some use cases that Samsung has worked with in telemedicine. And then we will hand over to the partner, Ohum Healthcare, so that they can talk about their solution and about their experience with the telehealth industry. So to start with, just a brief about the Samsung Group. So you may have heard about Samsung in the context of, say, electronics, which is mobile phones, chipsets, displays, etc. But Samsung as a group is much more diverse than that. So we have a focus on a lot of different domains such as construction, engineering, chemicals, financial services, etc. So it's spread out all over the globe with close to 500,000 employees in 90 countries. And we have over like 670 offices in all these different domains. So, and because we have such a wide competence in domain, so competence in technology and various fields. So we also work with customers across various sectors. So it could be, in the government, manufacturing, education, hospitality, logistics, finance, and the focus of today's webinar, healthcare. So yeah, getting on to the topic of today's webinar, which is primarily related to digital health and telemedicine. So we are going to have a short poll from our side before we start on this topic. So I think you will be able to see it in your poll section. I'll give you a few seconds to respond to that. Okay, thank you. So just to continue on that note, so we are talking about the rise of digital healthcare, so which is mainly about telehealth. So as you can see, because of the pandemic, there's been a huge change in the way that we receive and providers give healthcare. So basically, telemedicine helps doctors and other private care institutes provide care without any like in-person visits. So with internet access on a device, which could be a phone, a computer, or a tablet, you can easily consult with a doctor and receive some care online without actually visiting a hospital, and it makes it a more efficient and overall low contact experience, which is why it has really taken off since the pandemic. So there are three aspects to this, which is adoption by the patient, what the providers of health, which is the doctors and hospitals, think, and also how it's provided more opportunities for digital innovation in this domain. So just to go into this in a little bit more detail. So the first one is that, like I mentioned, there is a huge adoption of telehealth solutions in Asia by patients. So especially due to the pandemic, you can see that telehealth is quickly becoming part of the national healthcare system. So a lot more adoption has come in from the government side itself, and because of the low contact nature, and also it's an overall more efficient experience where you don't have to spend your time commuting and waiting at the doctor's office. It's become more and more popular. So especially with the increase in the aging population in a lot of countries, telehealth is being used a lot more to, especially for use cases like follow-up appointments, or if you have a chronic illness, to get it checked out on a regular basis. So as you can see, there are a lot of emerging health platforms. So it could be anything from scheduling systems to actual video appointment systems, or even something like medicine delivery systems. So you can see that there has been a steep rise in customers and registered users in all these platforms all over Asia. And there's also been a lot more integration with formal healthcare systems like the government to help streamline the adoption of telehealth in a much quicker and efficient way. So going to the next uh, focus on what the health leaders think. So like I mentioned, due to the pandemic, there is a lot more adoption of telehealth. So there are a lot of acute or super specialty hospitals which have taken this up, and this has helped ease a lot of use cases such as pre-op and post-op consultation, and also provided easier outpatient management. And you can see that the shift in remote or virtual care is increasing in priority in a lot of countries. Like in India, about 75% of hospitals have shifted to have a prioritized virtual care, and similarly in Singapore as well. And also there's a lot of investment that is happening in telehealth technology during and after the pandemic as well. Like in Australia, there's some financial support that is being provided where the investment in telehealth is being matched by the Australia government. And since April 2021, they've also focused on providing greater support. And in India, the government has issued some guidelines for telehealth to comply with the existing medical care guidelines. And also coming to the digital innovations. So this has opened the door for a lot of ecosystem to develop around this virtual health setup. So we have emerging technologies such as 5G, IoT, and artificial intelligence. So 5G, when it comes up, it has zero latency and quick, which results in quick communication between devices. So this will help real-time collections and of data, and also video calls to happen quicker. And with IoT, you have a lot of wearable devices that are coming up. Like you've seen cases where things like SpO2 and even BP in some cases are monitored through wearable devices. And you also have other sensors and software which can be used to collect data and monitor patients remotely much more efficiently than what was happening before. And through artificial intelligence, you have better operational efficiency and improved treatments that are possible. So it also has resulted in development of other workflows. Like you find a lot more digital technologies for everything from like scheduling appointments with the doctors virtually, as well as video calling technology, and also post care where you have things like fulfillment through medicines and better patient communication that have been improved through digital innovations. So I'll now there's time for another poll now, so request you to please look into that. And also handing it over to Sarah for taking up the next section.
All right, good afternoon, everyone. This is Sarah from Samsung Research Philippines. So for the next part, we are going to discuss about value proposition and what makes Samsung the right partner for the healthcare industry. Here to discuss, so first we have Knox. This is protection, Samsung Knox. From Samsung Knox defense grade security, a host of solutions and technologies partnering with 5G AI, IoT as previously mentioned by Ranjani, and certifications as well as government certifications and industry certifications prove that Samsung would be the right partner for the healthcare industry. Some examples are as follows. So, for example, in item 1, Samsung Knox, keeping the medical and patient data safe. So, we have the Knox Vault, we have also the ESEs, then we have the multi-layered protection, real-time protection that is always on. So, whenever you turn on that device, the security checks is always going on in the background. Hardware-based encryption, so this is also a security feature for our products. Secured Wi-Fi network encryption is also available. And then for patient-first solutions, we have a host and a wide array of solutions from our partners and other repositories from where you can choose to select and build upon your applications and solutions. So we have Knox Partner Program, wherein we are giving ISVs the SDKs and tools needed to incorporate the Knox policies and APIs into their solutions. And then we also have for non-Knox partner developers, we have Samsung developer site. So in that website for Samsung developers, you can try to test the look and feel of the applications, the behaviors using the remote test lab tool, as well as do some practice exercises with the other SDKs that are commercially available via Samsung developers. So for in terms of support, KPP is always free flowing, so you can ask directly from the portal or post your queries directly to your regional TAMs and the Samsung representatives within your region. Then for the third item, we have here opening up the digital healthcare ecosystem. So leveraging Samsung's ecosystem to create an open and integrated environment. With our open and seamless connected ecosystem, we can build the solutions you need together. So this is again leveraging on the infrastructure, the hardware, the solutions, the devices, as well as the wearables that we currently offer. Then next slide, please, Ranjani. So we have here a host of different nations that are, oops, I think that's a different one. Okay. So trusted by expert and government bodies. So these are, for example, we have here common criteria, FIPS, and various government certificating bodies, which proves that Samsung Knox has successfully met the rigorous security requirements by governments and the major enterprises around the world. This, in turn, helps provide business users with a robust mobile security solution. All right. Then this one, we have here the partnership we have with Google and Microsoft. Oops, sorry, backslide please. Thank you, Ranjani. So we have here our partnership with Google and Microsoft. If you are not aware, some of the solutions, specifically back in 2021, include the different partnerships with Google and Microsoft to extend and create a better environment for the solutions and offerings that we can deliver to the market. So currently, the Samsung's large ecosystem has, well, 79% of Android users, and majority of those are using Samsung for businesses. This is currently the trend and has been for a few years now, which makes Samsung the ideal partner all the more. All right. Next slide, please. I think this concludes the slide. Yes. So for the success stories, sorry. Okay, there are some questions popping up, but we'll have to deal with this after the webinar. So please stay in tune and hold on until the end. Yes. Back to you, Ranjani.
Yeah, thanks, Sarah. So just to give you an overview of some of these success stories that Samsung has in healthcare. So mainly focused on the enterprise mobility part. So today I'm just going to discuss 3 use cases very quickly. So the first one is virtual rounding, which is basically used in hospitals to monitor patients in their rooms. So we have developed this robot which has a tab which shows which is like the communication interface between the doctor and patient. And this reduces contact between the staff and the patients in isolation wards during COVID, and reduces the use of personal protective equipment as well. And this helped deliver medicine and food remotely to patients and help the doctor and nurses communicate with the patient who is in isolation. And the next one is accessing remote expertise. So this made any expert knowledge available in remote areas. So in Australia, there was a lot of population in rural areas without access to healthcare in cities. So through this tablet device, you can increase efficiency of operations through consultations remotely and limit exposure to infectious patients as well. And there was also an integration of an ultrasound solution with this tablet, which helped with data collection and also with collaboration and guidance remotely. The third one is monitoring uh, uh, a monitoring use case for clinicians. So because of a lot of critical care hospitals having very limited capacity, and due to this readmission costs as well. So this solution helped with some remote management of patients. So they just have to enter some of their basic information in the tablet device for review. And through this solution, you could also share some questions and reminders, and also had a telehealth application which helped with remote monitoring and also with data collection. So the last one is also using wearables. So like I mentioned, IoT and this kind of connected devices ecosystem helps get more real-time data. So with the Samsung wearables, patients were able to as in doctors were able to see patient information regarding their heart rate, blood pressure, or any fall detection type of uh, data as well, because of the Samsung Watch 3, which was also connected to doctors as well as the family members' mobile devices. So in case of any alert information, they were able to respond with a much shorter turnaround time. And this was especially useful for patients, especially aged people with chronic diseases, which needed constant monitoring on a regular basis. Yeah, so that's it from the Samsung side. So I now hand it over to the partner, which is Ohum Healthcare. So before we go ahead, I would just like to quickly introduce the speakers for today. First, we have Mr. Udai Kumar, who is the CEO of Ohum Health. So he has around 30 plus years of experience, and he's the founder of Ohum as well as other startups in this field. So he has deep understanding of delivery models, and has a specialty in healthcare as well as human capital management and software development and operations as well. And also like to introduce Mr. Sanchu Shanmugam, who is the Senior Vice President of Ohum Health. He has 20+ years of experience in product as well as solution architecture. And he has been very prominent in creation and execution of next generation product with product stack, and in areas related to application interfacing and business processes. So over to you, Udai and Sanchu.
Thanks a lot, Ranjani. Good morning, everyone. I hope you can see my screen now.
Yes.
Wonderful. So, good morning, everyone. Thanks for joining this call, and Samsung team, thanks for giving us this opportunity to present the way we see this engagement going forward with Samsung. So, in the interest of time, I'll just quickly go over the presentation. Yeah. Sorry, the Ohum Sky we call our platform as one of the Asia's biggest digital health platform currently. When we say the biggest digital health platform, we consider the number of people already onboarded in the system and the coverage what we are having for the region and the verticals. That's why we proudly call ourselves as the biggest digital health platform. The main vision of our organization is to be the world's best healthcare transformation company with an affordable cost. Of course, there are many in the thing. Only the affordability comes matter when we talk about the region like India and the developing nations and probably the underdeveloped nations. So like that's our focus area. And our mission is to enable 4 billion people at least through appropriate adoption with a quality healthcare, with a complete clinical documentation available, with a longitudinal medical record for them. Our platform, we continue to call our solution as a platform because it caters from a single doctor, single unit clinic to a 1,000-bedded multi-speciality, multi-facility, multi-location units, and alternative care, health, telehealth, and the chronic disease management, the patient portal by itself, the patient self-care. We cover the whole 9 yards of all the verticals which is possible in the clinical care transformation and the clinical care area. So that's why we call it as our intent is not to manage the administrative side of the hospital or the doctors. Our intent is to manage the root cause of what is happening in the hospital, why probably the cost is going high, the re-engagement with the patient, the readmissions, why it is happening high. Technically, the errors, which are the root cause of various mismanaged executions in the healthcare in the current situation. We wanted to identify each of them as much as possible. Of course, like there are various white papers, various studies done by prominent institutes on this. We wanted to pick each of them and start targeting one at a time and get that through. So the very common medical errors are either the misdiagnosis or an medication errors or an unnecessary treatments, unnecessary tests and procedures, or a wrong patient getting a wrong medications or a wrong treatment, wrong sample, not coordination, hospital acquired infections, the missed warning signs by the clinical team, or the miscommunication of the care to be given or post or pre the admission part of it. These are the very common medical errors which happen in the industry on the ground. So we address through our platform each one of this to ensure the quality of the care is improved at a greater side at a lowest cost possible, and even without knowing that it is getting improved by a period of time, over a period of time. Current limitation of the healthcare IT system, I'm not talking about the clinical practice or the hospitals, but the IT systems, what we see mostly, which are kind of in the affordable sector, I would put it, either it can be incomplete medical records. The medical records are episodic, not in longitudinal. A lot of things are managed in paper, so the loss of paper, the translation of the what is written and what is transcribed into the knowledge of the doctors and the dispensing of the medicines, the clinician engagement, the patient engagement. these players are very important players in the healthcare system, but most of the IT systems currently, what we see normally, they don't address to this. So our goal is first, have one longitudinal medical record for the patient for life. So if a patient is born in a hospital, which is in our setup, till his end of life, we need to maintain one longitudinal medical record. So any doctor at any given time would be able to see starting of his birth details till what and all the patient care has been given till date on that part. We also focus and follow, not forcefully, but like in the behind the scenes, as much as standards possible, including the ICD-10s are in or all decoded inside the system. The CPTs for any insurance management and the procedural management part of it, LOINCs, SNOMEDs, and from the integration perspective, we are fully HL7 compliant, fire compliant. So that is how we start enhancing the safety, the interoperability, and the standard practice within the institutes. We do engage with the clinicians by having a consistent interactions with the clinicians while using the application, by giving them enough alerts, not to fatigue them, but enough alerts at the right time. And the patients, we do the nudging program by sending them reminders, sending them alerts, not just for appointments, but even for certain activities if he has not done. So in our use case, like when the Samsung integration happens on this part, if the user is using a Samsung watch, we can use a nudging program to push him through, okay, you are supposed to take a medicine at this time. You are supposed to make another 50 steps, another 500 steps, another 1,000 steps. So those kind of things will increase the patient engagement. So the patient will get engaged. That's the way we operate on that part. Our platform, we have set some target goals when we started engaging with the public health. One of the states in the India we have completely covered with our platform, running from a single data center, covering the entire state per se. So when we started this program, we had our goal set as not about the number of appointments per se and all. Our first thing, we wanted to reduce the footfall burden on the district hospitals as much as possible, and transform that burden or the footfall into the local CHCs or PHCs or the care centers as much as possible without reducing the quality of the healthcare, the care given point. So our target was to reduce it by 50%. And the second target, what normally in general, not only in the public sector, even in the private sector, a lot of times, what we as a consumer, what we get kind of annoyed or sometimes irritated with is the waiting time, and it is indefinite. We do understand the doctors will have other priorities and everything else on this part, but the wait is something we do not appreciate much. So that is one another parameter which we have taken to reduce the waiting time. Initially we thought of having it at 50%, but like we thought 50% will not make the impact what we wanted to do, so we nudged it by 75%. And at least the 50% of the regional population we wanted to be up in the system. This includes not just the demographic part of the story, but the clinical data, the true clinical data about how they're clinically progressing, including the vitals, including the diagnosis, active, chronic diagnosis, acute diagnosis, any of the lab orders and the lab results and the trend and associated with the lab results, and his health progress by on a whole should be available at least for 45% of the population we wanted to be in our system. And 20% reduction on the queues in the outpatient by enabling online appointments, kiosk appointments, and patient portal based appointments. That's our goal target for what we wanted to do at a quantitative level. So this we retrofitted after a couple of years of usage of the application. This is one of the state where we have implemented our solution across all the hospitals, about 850 facilities onboarded in the 18 months. We have covered about 127 million appointments as of date, and about 6.7 million admissions across the hospitals. So all these targets, what I was talking about, 50%, 75%, 45%, 20%, which enables direct impact on the patient experience within the hospital, has been achieved. So that is one of the greatest thing which never happened in the healthcare platform in the public sector as of now, what we talked. So this is the quantifiable data what we have achieved on that part. I'll go a little quick on these slides. Basically, the fundamental idea of our platform is to serve a single doctor clinic to a multi-doctor, multi-speciality palliative till the palliative care. Every aspect of the hospital healthcare industry should be covered. Let it be administration, let it be the management, let it be the clinical side, let it be the ancillaries. Any of that part like is covered. So we cover all the appointments which are very common on this part. We cover the CSST part, the blood bank, the EHR, which is an HIE integrated system, which has a longitudinal medical record from multiple sources. We have telehealth, we have e-prescription, we have alerts, reminders, CDSS to enable the decision support, to enhance the decision support system for the doctors on the site. And we do have a wide variety of integrations done to the existing state applications, including Aadhaar, the GIS, the 108 ambulance, eMitra, any of the payment gateways, SMS gateways, and the email solutions. And of course, we have done a small pilot when it was done for the blockchain as well. I will talk about the outreach programs, which is in the other side, a little detail in the next slides. The outreach program is technically where the healthcare visits the patient, not the patient visiting the healthcare. So all these ASHA workers who visit the pre and post antenatal and the pronatal care, these are all done by our application. Of course, most of the devices which has been used over there by the ASHA workers are all Samsung, which is a good news for us because we have already indirectly working closely with Samsung as a partner for usage of our platform on the ground level. So we do care about the wellness clinics, adolescent clinic, the chronic management, geriatric and rehab management, and the data capture is also done at an extensive level to populate any registries for the current need and the future need of the region and the management and the governing bodies. So like the chief secretaries of the state and the CMs of the state and the health ministers of the governing body. Yeah, the urban well centers or the PHCs, which we have enabled, technically we can finish a full appointment with a doctor under 50 seconds with the quality of a healthcare with no compromise on the quality of healthcare. Technically, this is achieved through controlled workflow where the patient visits the PHCs. And I'm not sure if you know about PHCs are not manned normally by a well-qualified doctor. They are normally manned by a medical assistant or a nurse or a junior resident kind of a doctor. So we enable them with the controlled workflows where all the protocols, everything is preloaded. So with the symptoms, what they have done, the system application itself drive them to the diagnosis, to the documentation, to the investigations, and to the drugs. It suggests everything. So the quality of healthcare is not compromised, and it can be done under a minute. This is something which we have achieved again in the state of Rajasthan, and it's a completely paperless, cashless with a low infra, because most of these things reside on the remote areas of the state. So we have a beanstalk separate standalone mission governed at this point by Raspberry Pi. Of course, when Samsung has their beanstalk missions, we will consider that also to take it up. But all the mobile tablets, the smartphones, and the printers, obviously they can be sourced from Samsung immediately. This enables us to reduce the footfall, which is one of our target goals at the district hospitals, because the quality of healthcare is arrived at the PHC itself, so that people feel comfortable after first, second visit, and they continue to go there instead of going to the district hospital and wait for long for their turn. The telemedicine and home care, as rightly put by the Ranjani and the team during the Samsung presentation, the going forward future of healthcare will primarily be telemedicine and home care. The hospital admissions are going to go down either because of the comfort, affordability, and obviously the availability also. So we do have a complete telemedicine and the home care solution, which goes hand in hand with Samsung vision of enabling healthcare at home and enabling healthcare for the patient at their comfort. So we do have a patient unit which can completely be a Samsung enabled platform, and we have a specialist unit. Again, it will be a Samsung enabled platform, and we do have several specialties which are done. Again, we have implemented this in several areas, including outside of India, in Sudan, UAE, and of course in Rajasthan as well. When we talk about the healthcare deployment, solution deployment on a public health setup, it's common to see it happens over a period of 3 years. It happens over a period of 2 years. With our standard process and protocols and the solutions set up so stable, and it covers the whole 9 yards, we expect, and this is something which we have proven with our deployment also, we expect start and end to be done in 20 weeks, where the phase 1 is 4 weeks. We divide every 4 weeks deliverable kind of a phase manner. So we start with enabling the basic setup, like an appointments, what the patient facing things, the front office side of the story. And at week 20, we will have the full of the registries, the population health data, the disease surveillance, which technically goes to the governing bodies of the health within the region, if it is a state or a district, whichever way it is. So that is how we cover. We would be comfortably live, covering the whole 9 yards of the healthcare delivery within 20 weeks of the start. Talking about the non-functional side of the story, we are fully compliant with all the digital health standards which are tagged, including the terminologies, coding systems, audit trials, the encryptions, the data integrity, the digital certificate. And our solution, our platform is consistently, we do it on a periodic basis with every release. Safe to host certification by an independent audit firm. That is something which is mandatory for us to keep it in the production setup for the state level, and we are completely compliant with all the digital health standards. A few reference letters from our implementations at Rajasthan and West Godavari, what we have done with the public health. This is something of our own thing, how we have visualized ourselves, our partnership with Samsung, and how do we see our product will change the healthcare delivery side of the story. A few highlights of the success stories. We have deployed our first stage 6 hospital was done on our EMR platform in India. Home telehealth, we were one of the early starters of that. We have done a meaningful use implementation for a US based acute care rehab setup, long-term care setup. We do have a chemo manager, which is an oncology specific thing, which we have deployed. The EMR, the chemo manager, the chemo planner for an oncology setup in Jordan. We do have an enterprise setup for a full country of the hospital management system. We are running a telemedicine program for Sudan. We do have we work with a small facility in West Godavari, which was part of Bill and Melinda Foundation, and that was a success story which gave us the first confidence that we can change the public health delivery system, the way the healthcare is delivered in the public health setup. And of course, we have automated a full state of Rajasthan, and we do work in the UAE for a multi-location, multi-facility hospital and a multi-specialty hospital in south of India. Coming back to why we are talking here and why are we here, we feel Samsung with their vision, with all the discussions what we had with the team, and our vision go hand in hand, and thus Samsung becomes a natural partner for organization like Ohum in the public health space partnership. So it's a very targeted healthcare solution. The way we visualize Samsung and Ohum to work is an hospital with fully enabled, fully Samsung-enabled applications on the platforms, like Knox for the security, for the digital boards, for the accessibility and the readability of the patients, and for the navigation of the patients. the devices wearable for geriatric care or the elderly care patients. For the monitoring, the Samsung tablets, and of course the robot was a wonderful thing which can be used in a situation like an COVID kind of a situation in the isolation wards, and the tablets, the smartphones for the outreach program and the nursing care program, where the mobility enables them to provide the care at the patient side, not finish the care and come and update the data. So this is how we visualize this. We kind of inherited the image from one of the Samsung brochures. We expect fully hospital. We expect to find one pilot hospital where it can be fully enabled with all the Samsung devices running on our platform, and the backbone of the security being done by the Samsung Knox layer. That's how we see how we can do a partnership and create a model hospital where we can demonstrate how to improve the quality of the delivery, healthcare delivery, and how sophisticated it can become. Of course, all the efficiency parameters of how Samsung can help, the team has spoken in detail, so I'm just going to skip this. That's all from our side, from the Ohum side on the application. Any queries, any questions, any Q&As, we are open to answer. Ranjani, I'll back to you.
Yeah, thank you so much, Sanchu and Udai, for conducting this session. So it is very insightful to know about Ohum system and what you're doing in terms of digital health as well as telehealth. Yeah, is there any questions from your side? We'll be happy to answer them through the chat, so do let me know.
All right. Hi, Ranjani. I'm reading the chats, and we have some questions here I'd like to forward to you. So first off, we have, does the solution support voice-to-text capability? So that was the question. Does the solution support voice-to-text capability?
Yes, we do have. So there are two ways. One, the native application, the native device voice to text is obviously supported, no challenge over there. And we do also have integration with the likes of Dragon, which is dedicated for a medical transcription and the medical voice to text. So both we have. Dragon comes with additional license, whereas the native comes without any additional license or cost attached to that.
All right, thank you. And then seems like we have another one here. What type of analytical dashboards and reports comes ready with the solution, if any?
Sure. So for us, of course, like we do have the standard set of dashboards and analytics, but the power of the platform is not what we have. The power of the platform is technically what you are enabled with. So with our platform, you are enabled with any kind of dashboards, any kind of slicing and dicing of the data from the data lake, that you can do it with zero technical knowledge, with some amount of training. So the end user, when we say the end user, not the doctors, we don't expect the doctors to create it, but the trained user of the institution or the hospital, they will be able to create. What we actually have is all the standard MIS reports, which enables either the front office management, the billing management, the clinician, the footfalls, or the inventories, what is the stock, the near expiries, the reorders, what is an outstanding collection revenue, which may not be very relevant for the public health. All those are standard. Those are all available. From the dashboard perspective, we have divided into the, depending upon the category of the users. So we have the CXO level dashboards, which gives them the high level knowledge about either the single institute or a group of institutes. If it is a set of institutes, like an health secretary may not be interested in seeing one hospital data points, but like you'll be able to see the whole district, the data point. So that kind of a collaborative level of information we do have. And if it's an hospital administrator who is joining, who will be logging in, he will see his hospital's data alone. And of course, the clinical data, the adoption rate, how well the adoption is there, that is standard. And the registries in terms of the diagnosis. So the disease surveillance is one of the key elements for an EHR platform, where we enable them to identify what is the disease vectors which is happening at a period of time. So if there is a particular vector which is coming again and again in a region, for a wide region, like you will be able to identify there is something which is happening in the region which is causing this kind of viral vectors, like which needs to be taken care of. So from the health department side, they can take care of either by sanitization or by taking some preventive camps on that part. So that those kind of things are all standard available.
All right. I hope that answers the question. And we have another one here. Do you have any solution for camps or those that are located remotely?
Yeah, so we do have a beanstalk, like a bundled platform, which runs from a small box. We currently use Raspberry Pi. If the technology team is there, they would understand it this better. Raspberry Pi is a small computer by itself on a box. So we do have such devices which can be taken, and they are being used as remote as zero network at the institute level, or for the camps where the internet is not stable. And even at the oil rigs, if they are going for mining, or if they're going for any camps to a remote oil excavation areas, so all those areas they can use this. And when they come back, since our idea is maintaining longitudinal medical record for a patient, when they come back into the network, it syncs up to the mother server, and it pushes all the data what is captured offline during the camp or the remote system.
All right. I think we have room for one last question. For this one, what volume or large patient data has the solution handled?
Okay, that's an interesting thing. So I can tell you this way, like two aspects. I'll give you one from the public health, one from the private health. The public health, on a daily transaction, we handle about 25,000 appointments from a single instance. Of course, the server capacity, everything has to be beefed up to make sure that meets the need. So I'm talking about a single day, a daily transaction of this. And on a private setup, this happened during the COVID time, where the vaccination, the RT-PCR was on the highest thing. On an average, we handle about 1,000 appointments, 10,000 appointments on a daily basis. So if you see, on average, monthly rate on a private sector, our solution could handle about 3 million appointments from a single instance. I'm not talking about a collated multiple instances. A single instance for a single group of hospital or institute. On the public sector, which is multifold of that, at least thrice of that, so about 5 to 6 million appointments that we will be able to handle that. So the scalability, horizontal and vertical, is something which we don't expect our customer to worry about. Doesn't matter what growth they are projecting, the solution should be able to scale. And what we have done now is not the maximum. This is not even close to what we can handle. And there is no limit to that.
I see. Cool. All right. That's all the time we have for questions for now. Thank you very much again to everyone who attended this event, especially our partner for today, Ohum Healthcare. I hope everyone has an enlightening experience during the session. And if you do have your questions or queries regarding the solution provided by our partner for today, please feel free to contact them on the link that was flashed earlier. And then for Samsung related solutions and queries, please feel free to contact the Knox Partner Program team. So the email addresses for this would be shown shortly right after. Payal?
Yep. Thank you, everyone.
I would like to thank everyone and the Samsung team to provide this opportunity. We from Ohum look forward for a long-term engagement with Samsung. Thanks a lot for your time, everyone. All the participants, thank you. Have a wonderful day.
Likewise.